Hello and welcome to the program Connect with Enoch. As always, we do this whenever issues of local, national, and international importance come up. And today we're going to be sharing words with one of our brothers, from the noble profession. A brother I call a brother from another mother. He got married and never told me. And then, he had his birthday, he never told me. The seller also went by, never told me. Had his first kid, never told me. He didn't tell me a lot of things, but for this one, he has told me. So I'm going to have words with Mr. Santi, former Jimta president, and also um, an employee with Kolebu Teaching Hospital. We're going to be sharing words about what is happening with our noble professionals, the nurses, the strike, the impact, and so on and so forth. He's my guest on Enoch Connect today. Welcome, sir.
Thank you very much.
How are you?
It's an honor having you.
Yes,
Grant this
yes.
interview.
You're welcome. You're welcome. So, what is happening with the nurses? They are saying that they are not going to go to work. What is really going on?
Okay, thank you very much for the opportunity. And I
Yeah.
would like to use this platform to appreciate your continued support for nurses and midwives in this
Mm,
country.
you're welcome.
Yes, the main reason for nurses going on strike is to demand for what is rightly due nurses and not a demand for luxury.
Okay.
Yes, it is all about the condition of service for nurses and midwives that was negotiated for in the year 2024
Mm-hmm.
and now pending implementation. So, with
Mm,
the situation at hand, uh, when the negotiation took place last year, that is 2024, within
mm-hmm.
the Nursing and Midwifery Fraternity, we have the Ghana Registered Nurses and Midwives Association as the main body that holds the bargaining certificate for nurses and midwives in the country.
Mm,
And they were on the negotiation table, whilst we have other unions that are also part of the profession, the likes of Union of Professional Nurses and Midwives Ghana, Professional Association of Psychiatric Nurses Ghana, and that of the National Association of Registered Midwives.
mm,
Some of these smaller groups within the fraternity, specifically that is a Professional Association of Psychiatric Nurses, took the matter to court on grounds that the negotiation to them they felt was not inclusive and didn't reflect the interests of all nurses and midwives,
mm.
and took the matter to court. So an injunction was served, making it impossible for implementation of the condition of service until January 2025 that the whole matter was completely resolved out of court settlement, and it meant that after the out of court settlement was reached, the issue is now over, and the relevant stakeholders can go ahead to implement the condition of service that was being signed by the ex-Wal administration. Fast forward, the leadership of the Ghana Registered Nurses and Midwife Association engaged with the Minister of Health on several occasions, leading to the reading of the budget for that was held in March, hoping that we will be considered for our condition of service to be implemented. However, it got to a point where leadership felt that things were not moving smoothly as they have envisaged and declared a roadmap for a strike, which started last week, Monday, Tuesday being kind of red armband. Then Wednesday, Thursday, Friday was withdrawal of OPD services, emergency services in that regard. Whilst hoping for the government to have acted in a proactive manner to avoid we getting to where we are today. But unfortunately, the needful was not done, and I think we saw the social media theatrics and all those stuff playing out,
Mm.
where the minister is saying that he has been able to put measures in place to reduce the impact of the strike by GRNM and all those stuff.
Mm-hmm.
Today, as we talk, since Monday, nurses and midwives who form part of Ghana Registered Nurse and Midwife Association are the majority within the profession and have withdrawn their services. And we have patients struggling. We as nurses and midwives, we are empathetic in whatever we do. But our empathy that we have for patients is not like we fake it. It is real. But the fact of the matter is that we as nurses and midwives are demanding for our fair share of what we think is due us. Not that we are being deliberate in our actions just to see to it that citizens or patients die. We care so much about them. But the fact of the matter is that at this material moment that we find ourselves, I believe it is a matter of engagement, effective engagement. If you are not able to grant everything, meet nurses and midwives halfway, whilst you push the rest to the future. But the press conference that was held yesterday by the minister coming out to say that they can only consider implementing the condition of service in 2026. The fact remains that condition of service for public sector workers is subject to review every 2 years.
Okay.
So if you are pushing it to 2026, it means that what was negotiated for in 2024 has not actually reflected. And you are not going to back, and there's not going to be any back pay. So invariably, we are going to start afresh, and 2 years gone wasted. And you saying that there is no money to meet the demands of nurses and midwives, most of the things nurses and midwives are demanding for are not things that are actually new. The new item introduced on the condition of service is the renewal of the nurses and midwives.
Yeah, we'll be going through the list very soon.
Yes, and that is about 70 cities. So, and all what we are requesting for too is not like everything is going to flow in a fluid or monthly basis. These are one-time payment if you look at the items that we have over there. So I believe that we still have another budget to be read before the end of the year. If we indeed prioritize the needs of Ghanaians' health, then we should be able to engage effectively. I believe that there could be a document signed binding the government that we will consider you somewhere the next budget that will be read. And in such an agreement, I believe the leadership of GRNM will be sensitive to say that government have acted in good faith by coming out with an agreement being established so that they can consider, since you are saying already we are not part of the current budget that is being in read or in motion. And with this, I believe that is a form of meeting us halfway. Then when you read the next budget and you make such provisions, we can look at how it's going to cater for the arrears. But blatantly telling nurses and midwives to go back to work and consider it being implemented in 2026 is not fair. And that is not proactive leadership. At the end of the day, when two elephants are fighting, the grass suffers. And the patients are suffering. People are dying.
So you think that the press conference, sorry to cut in, but you believe that the press conference held by the minister was out of order or was not, the words were not chosen correctly or rightly?
They chose their words correctly per their discretion. But from my point of view, I am seeing to it that certain statements shouldn't be made. I don't know the rationale behind some of the words they chose to use.
Okay.
For example, you are coming to publish list of facilities where people can get services from, and you are going to call on retired nurses and midwives to come back to post. Trust me, these two particular issues are unfortunate statements that I least expected to have come from the Ministry of Health or the minister in person. Today, if we ask the Minister of Health, does he know where these retired nurses and midwives are? Is he having their data? Can he locate them? And are they in a good state of health and mind to
that
render
is the point I'm coming to. You see,
citizens?
When it comes to nurses, some of us are always loud, not because of anything. We are surrounded by nurses. For you and I to survive, a nurse will have to play a major role, and each and every person will have to play a major role in life, one way or the other. But I believe we're supposed to find ways and means on how to go about matters. And this kind of statement sometimes get people agitated, make people very angry. So look at these retired nurses. Some of them went on retirement with some scanty amount. In spite of the kind of situations that these people are in now, you are still going back to tell them that even though some of you were not treated fairly in the past, come back and still continue with your service. Is that not even an insult?
It's an insult.
I don't know why. Everything we want to politicize it for some reasons. I believe the minister could have done better. But I know you want to be diplomatic, but you're going to have a show on this and tell him as it is. Because it was an unfortunate statement.
Exactly.
Go
Right
on.
now, as we talk, for a nurse or midwife to practice in Ghana, you need to have a license, certified license, an active one, of course. The retired midwives and those staffs today, unless I want to throw the law aside and just do things haphazardly as a state, we are not a banana republic, because it means that for a retired midwife to come back to post and even render service for 24 hours or 8 hours, the person must go and renew his or her PIN. Are you now telling us that these retired midwives should use their own money to go and renew their PIN, or you are going to renew their PIN for them to come back and work immediately? And they come in to volunteer. Do you even care to know whether they are even in a good state of health and mind?
That's an interesting question.
This is where you realize that sometimes we take Ghanaians for granted. But if it is another person holding a serious office in this country that falls sick, we will be able to make provisions to fly the person out of the country to render care to the
Like
person.
someone is in the state and is refusing to come home for accountability.
You see that? So it is unfortunate that when it comes to the masses, we treat them anyhow. And secondly, you saying that you want to publish list of facilities. Ghana is not Accra and Kumasi alone. Ghana is not Accra and Kumasi alone. I'm from Tumu, in the Upper West region of Ghana. How many private facilities are even in Tumu? That you think that if you want all of them to go there and receive services, it will be possible?
Maybe they will make means of transport easy for them to go there.
and today, if not the military hospital and the police hospital in Accra with other big private facilities in Accra, we don't have these facilities scattered across the country. So you realize that all the measures the minister says he wants to put in place are not meaningful solutions or measures that will address the issue. And as I said, I'm not speaking for the leadership of GRNW, but I know they are sensitive, and all of us today, as we are seated, knows that things are not easy. If they happen to engage with the leadership, for example, with this proposal from my point of view, that the last quarter budget that will be read, we will make sure that we make provisions for nurses and midwives. However, for us to act in good faith, for you nurses and midwives to believe us, we are going to sign an agreement that is going to bind us to act in good faith, consider you in the next budget. Trust me, our leadership will gladly call up the strike and ask us to go back to work. Wow. But telling us that openly till 2026, you are not going to do anything like that until 2026, it's like you are smearing insult on the face of what Ghanaians. Today, as we talk, the number of people that Korle Bu serve on daily basis, OPD basis, if you look at it, surgical department of Korle Bu Teaching Hospital, OPD alone, can attend to about 600 to 800 OPD cases a day. Then you look at the emergency department of Korle Bu Ridge and other hospitals. As they are on strike, ask yourself, where are all these people going? People are dying silently. And we think this is the way we can solve the issue.